The advice is simple. Just go do it. You know you want to. That's why you're in Nucleate. That's why you're listening to this podcast. It is not going to always be easy, but you're going to learn more than you ever thought possible. And you have the potential to achieve something that is going to make a huge impact, both for you personally and hopefully for the world. So now's the time. Don't wait.
This is the Nucleate Podcast, the voice of the next generation of biotech leaders.
Welcome to the Nucleate Podcast. My name is Sam Kessel, and on this episode, my co-host, Anastasia Janas, and I speak with Dave Messina, General Partner of Pioneer Fund, about his career and lessons for entrepreneurs as someone who has made the transition from academic to founder to VC. Dave is a veteran operator and investor, currently serving as General Partner at Pioneer Fund, where he has been leading health and biotech investments since 2019. He founded the RNA and machine learning company, Cofactor Genomics, that uses RNA and machine learning to help doctors choose the right treatment for their patients and led it to national Medicare reimbursement. Previously, he worked on the Human Genome Project, was a leading contributor to a large open source project, and earned a PhD in computational biology in Stockholm, Sweden. We had a lot of fun on this episode. We hope you do too.
Thank you for joining the Nucleate Podcast, Dave.
Thank you. Happy to be here.
We are looking forward to the conversation. There is a lot to cover, a lot of amazing topics covering both of your sides, your entrepreneurial side and your investor side. But before we jump into that, let's go back to the beginnings. Can you talk a little bit about your upbringing, about your childhood, and what led you to science in the first place?
Sure. I had a scientist father, so he has worked in high performance computing. And even with that background, I was not that interested in becoming a scientist when I was young. I did, I guess in hindsight, I had a microscope when I was a kid. But when I left high school, I didn't take biology in high school. And when I left to go to college, I was planning to go into international law or something like that, and pretty quickly found that that was not the direction I wanted to go into, and kind of stumbled into an internship with a mathematician, computer scientist who had started applying computers to biological problems. And that really drew me in, this idea that parts of biology at their core are a kind of information system, that DNA is code. And this was before computational biology was even a formal discipline. This was when first free living genome was sequenced. So this was Methanococcus geonotii. And back then, my mentor, Ross Overbeek, saw what genomics would become, this idea that when we have thousands or hundreds of thousands and now millions of genomes, that we can understand a lot of biology by comparing them. That when you look at the species that are different, what is the same between them must be fundamental to life. And when you look at the differences between them, those give you clues as to what is unique about each organism. So this was very early, pre-human genome, and really gave me a vision for what the field would become and how biology might unfold over the next 20 years. And so I jumped in right away.
Yeah, and this led you, or with some stops in between, this led you to your PhD in computational biology at Stockholm University. You shared a little bit about your vision of what the field can become, but a little bit more for our listeners. What led you to Stockholm in the first place?
Yeah, so it was somewhat accidental. I had been working on the Human Genome Project, and I'm sure we can talk a little bit about that. So that's, that was sort of one of the first stops for me, was being part of science on an industrial scale. And it opened me up to the possibility of heavily applied science, which was different from the sort of more basic research components that was typical in biological laboratories. And so that was an amazing experience to be part of that. I worked on software there that helped analyze genomes. We looked a lot at how to assemble large genomes. And then when the next generation sequencers started to come out, we had access to all of those machines in the technology development group I was part of. So Solexa serial number 1 that went on to become a Luminous platform was in our lab. And a lot of the work I did was around how to make sense of this new type of sequencing data that was coming off, which is much different than the relatively primitive way and manual way that we did the human genome. So after working on that for a while, I was starting to get restless and looking for something. And I happened to be on vacation in Stockholm and remembered that one of the leaders of computational biology was working there, and he convinced me to come do a PhD, even though I wasn't really planning on it. And it ended up being a great experience. I got to work at an incredible multidisciplinary research laboratory, bringing some of the best people in the field all together in one place. And I also got the wonderful experience of living in a different country for several years, which I highly recommend to everyone. I think there's something special about being able to be somewhere different than where you came from and have that immigrant experience firsthand. My father was a first generation immigrant, so me and my brother are sort of the first generation after that in the US. And I always had a lot of appreciation for that, but it's much different when you experience it firsthand, and helped me to appreciate not only the sort of a different style of living, but also appreciate where I came from more.
Yeah, that makes a lot of sense. And I mean, as immigrant myself, I can only stress that go out, seek out new experiences, new opportunities. And living abroad in another country for a long time, or like semi long time, is super refreshing and adds to your global vision. So you mentioned the Human Genome Project. So let's talk a little bit about that. You mentioned that you were core member of the software development team at Washington University Genome Institute. Can you give us a little bit of glimpse of your work and your thoughts, your feelings while doing that?
Sure. So it was an amazing time, and I actually sought out the Human Genome Project in Washington University once I got excited about genomics. It was one of the few places in the world that had a real concentration of people, doing computational biology at the time. It was like, let's call it maybe a few dozen people in the whole world at that time that was really doing serious computational biology, and like a good like a third of them, maybe like 10 or 12 of them, were at WashU and then involved in the Human Genome Project. And so at the time, one of the key challenges was how to put together, very large pieces of DNA sequence. So we had sequencers at that time that could do maybe 100 letters, 100 bases of DNA at a time. And, a chromosome is like millions and millions of base pairs. And so how do you efficiently assemble those? And there was a lot of work done on mapping using sort of new techniques and how to map those, which ultimately ended up being really critical for putting together the full human genome. And then layer on some of the advanced computational work that was done at Celera on the private side. The combination of those two together produced the human genome as we know it today, which is, I think, still the sort of most refined DNA sequence of an organism ever, or at least one of that scale. And it's really not even today possible to efficiently put together large pieces of DNA, because if you have repetitive sequence or other structural issues that we just can't span, some of the longer read technologies now can help with that. But that was an exciting time for science to see all that come together. And I was really lucky to be part of it.
We've heard about the private side on Solara in a little bit more detail from Peter Barrett previously. So curious to understand what that dynamic was like. It sounds like you were on the public side of the Human Genome Project, and then eventually it did intersect with the private side. So curious, what was the dynamic like between those two groups interacting, and how to impact the work you were doing in the approach?
Sure. So it was at times contentious. Certainly, the media like to play up the race or competitive aspect of it, but I think ultimately it was positive and motivating for both sides. And I think history shows that both sides were critical to kind of building what we now think of as the core genomic tools and that core genomic sequence. So imagine what it was like working in a laboratory with 300 people, some of whom were not formally trained as scientists, coming together to put together this enormous puzzle for the first time. And it wasn't just our laboratory, which obviously, was one of the lead institutions, but there are laboratories around the world. And 3.3 billion bases of DNA. You're sequencing it to a depth many times, not just sequencing it once, but many times over. And you're doing, manual gels to produce this. So you had maybe 96 wells of or lanes of DNA that you could do at a time. If you're really good, hard to load those. And then each one producing maybe 100 letters of DNA. And so think about that. It's like, you know, armies of people doing gels around the clock for years. A few years later, we were able to produce, so that took years to do. A few years later, we were able to produce the same amount of DNA sequence in an afternoon on a machine using, one person, maybe a couple of people.
Yeah, that's super interesting. And what were your learnings that you took out of it? And maybe some learnings for our listeners that they can apply to their endeavors.
I think that this idea of being able to move faster and go farther than it might seem. Something that may not be well known is that when the Human Genome Project was funded, it was known at the beginning that in order to be able to finish it, they would have to invent new technology along the way. And that's kind of a crazy proposition sometimes to think that you are setting out on a mission and you're going to have to do something that's never been done before to get to the finish line. That is pretty remarkable and certainly not something that is part of the standard curriculum you get when you're studying biology in school. And I wanted to be a part of it. That absolutely, I think, motivated a lot of the choices I made later in my career.
So, at what point at the time in your path did you decide that you want to co-found Cofactor Genomics? Was it the experience with the Human Genome Project that led you to this inspiration and ultimately this more entrepreneurial side of science?
Yeah, great question. So I had in the back of my head for quite a while, I think even when I was a teenager, that I wanted to start a company someday. And I wasn't quite sure in what, but as I got more interested in science, it made sense to maybe do something in that direction. And as I finished up my PhD, I started the company with some of my buddies from the Human Genome Project. And we had, even on the Human Genome Project, had done a lot of work in RNA. And it was at that time, not as well known as it is today. I remember when we were first pitching investors, we sometimes had to explain what RNA was. And of course, now after RNA vaccines and the pandemic, that people are much more familiar with it. But the core realization of Cofactor is that there were a lot of people using DNA to understand disease, and your DNA doesn't really change from over the course of your lifetime. RNA, on the other hand, is giving you sort of a real-time readout of what's going on in your body. And so it would make a really great molecule to study to help understand disease. And so we built Cofactor using RNA and using machine learning to help doctors choose the right treatment for their patients. And at the time, and still too often today, the tools that doctors have are not very predictive, and they're using 100-year-old technology, looking at cells under a microscope. And we knew we could do better. And so we ran a national clinical trial and validated the technology. And ultimately, I helped lead the company to national Medicare reimbursement. And it's in use today. And it's really, part of an amazing transformation for me personally, and I think also in the way to think about science of kind of getting out of the lab and creating tremendous value from it, both for patients and as a commercial product.
Yeah, that's amazing, especially going with this motivation and looking into what can we do better and what are the limitations and actually tackling them and having your experience and everything that you did before basically guide you to make a great company. So let's focus on the Pioneer Fund. So you had this great journey from bench to co-founding a successful company. And after this significant experience, you joined the Pioneer Fund, which is involved with the Y Combinator. So can you tell us a little bit about how does it work? So like what's the business model?
Sure. So Pioneer Fund is a fund of over 470 Y Combinator alumni who are backing the best Y Combinator founders. Now, my company went through Y Combinator, and the founder of Pioneer Fund saw other YC alumni angel investing in YC companies. And most angel investors can't invest in too many companies, and they're only investing a little bit of money. And so the insight was, wouldn't it be great if we had a real fund where we could invest in the top companies coming out of Y Combinator, and we could use the deep expertise of YC founders to help power that fund? And so I've been involved with Pioneer since almost the beginning and leading health and bio investments over there. And of the 470 plus YC founders that are small LPs in the fund, as well as part-time venture partners, we have over 80 of those are founders who have built companies in bio and health. And so for a very technical area like health and bio, it's kind of like a superpower for us to have so many people with expertise across the whole range of health and bio. So as we talked about, I have a background in genomics and computational biology, but if we're looking at a company in therapeutics or in digital health and really everywhere in between, we have people who have not just studied that, but have actually built in that space. And that gives us an ability to understand the nuances of a highly technical area and hopefully make good investment decisions from that. But it also allows us to look at a lot of different companies at scale. And so we have built a lot of technology behind the scenes that allow us to deploy a lot of people with a lot of expertise across a lot of different companies simultaneously. And because we're all founders, we have particular affinity, I think, and understanding of what it's like to be on the other side of the table. And so we tried to build the fund that we wish we had when we were founders, one that is fast, transparent, founder friendly, and that we really know our stuff, and so that we can not only provide a good experience during sort of the investment and diligence process, but also be helpful once we've invested in a company, because we have so much expertise, not just in bio and health, but the broader community at Pioneer allows us to help with lots of different things that our portfolio companies come across.
Yeah, that makes a lot of sense. And it's also very unique for founders to invest in other founders. And it's very, very valuable for those founders because you've been in their shoes and you know the challenges they're facing, and you can actually help them versus, I mean, you can help as not a founder, but being like having had this experience before ultimately helps. So,
Exactly. And we operate in that way almost more like an angel investor. And that we don't rely on others for diligence or de-risking. We're often the first check in. We make up our own minds, and as founders, we are able to provide the kinds of support and advice that helps I think other founders trust us as a result of our backgrounds.
it makes a lot of sense. So YC is like, it's widely known. It's one of the best incubators there out, and a lot of founders try to get this YC mark on their companies. But those companies, they are mostly in the technical space. So the investment timelines are sometimes shorter versus like the healthcare bio investments, where you are looking at more like longer timelines of a few years sometimes. So can you tell us a little bit how the synergy works between this like tech short term and bio health long term investment?
Sure. So I think one, it's not as true anymore that YC is solely focused on tech. I think while that may have been more true at the beginning of YC, 20 years ago when they started, YC has been investing broadly in deep tech and including health and bio for a long time. The YC is the YC for deep tech and for health and bio. And I think there is a perception that health and bio companies are slower, or whether they are slower to mature or slower to become valuable. And that's really not true anymore. I think we have seen, not just in YC, but in other companies in our portfolio, that the best founders in health and bio are able to move fast, and they don't accept the notion that science has to be slow. And moving fast in health doesn't mean cutting corners. It means relentless focus on translating technology into a product, on iterating quickly, understanding a real need that you're solving, and often talking to customers, whether that's doctors or regulators, or whether you've got a more traditional kind of customer. That's a key part of the process for health and bio companies, just as it is for building a new SaaS company.
Yeah, it makes a lot of sense. So can you tell us a few examples about your previous investments that have delivered well, that were successful? And like the second part of the question is basically, what do you think, what is the most critical factor for a company's success, being a founder and investor at once?
What makes a great health startup? Obsession with the problem, solving a clear need, and relentless execution. That's true of any company, and it's also true of building a great company in health. Some of the companies that we've invested in this space, which are doing really well, I'll start with Postera. So Postera is a great example. They use AI to accelerate drug discovery. Incredibly talented founders out of Oxford. Alpha Lee, at the time they started the company, had written several seminal papers on how to use machine learning in the medicinal chemistry part of drug discovery. And that design and test iteration phase of medchem is kind of notoriously slow and laborious and expensive. And they've been able to accelerate that process. We were the first to write a check into that company, and that was in 2020, and they now have over $1 billion in partnerships with Pfizer and Amgen. Why did it work? Well, you have world-class founders who were experts in the field. You had a massive market, and you had phenomenal execution. They've just done a tremendous job at productizing their science. Another example is Andromeda Surgical. So We've known Nick Damiano for a long time. He's a repeat founder, has built successful companies in the health and medical space before. And Andromeda is AI-assisted robotic surgeries. So there is a very common condition in men called benign prostatic hyperplasia. And the best procedure for treating this is something called HoLEP, which is a very technically challenging procedure to perform. And as a result, even though millions of men are eligible for this procedure every year, very few of them get this procedure, which is the best one, because there aren't enough doctors who can successfully perform this. So Andromeda has taught a robot how to assist the surgeon in performing this complex procedure much more effectively. Andromeda went from an idea to now having doctors using their system in patients in about 18 months, remarkably fast. And I think they're on track for regulatory clearance soon after. So that's a great example of a company in what might be considered a traditionally long, slow, and challenging space, being able to move incredibly fast, do remarkable work, and really execute on their vision very well.
Yeah, so I think this question is asked a lot, especially for investors who invest in pre-seed and early stage companies. But nevertheless, based on your amazing experience and dual experience, which I am stressing all the time here, what matters more, the idea or the team?
Great question. I think it's really between those two, it's the team. We often see founders, one of the things we look for in founders is something interesting and remarkable they may have done prior to the company they founded. People who have maybe even in their teenage years, maybe done something unusual, like been a chess champion or started a business. We backed founders who, like in the middle of college, built a six-figure business that had nothing to do with the company that we eventually backed. But you know, people who have just shown remarkable achievement is a good indicator for how they might be successful as founders. And at the same time, we see founders sometimes with an idea that isn't quite right, and they end up, being able to navigate their way to a better idea. This is part of the process of being an early stage company. You don't always sort of figure out product market fit right out of the gates. And so we look for velocity as a great indicator. It's one of the best indicators we found of what can make a successful founder. And you can tell velocity over a pretty short period of time, believe it or not. It may seem like you need to observe a company's growth or progress over years to assess that, but you really don't. We've seen people move incredibly fast. So Oleo Labs, one of the favorite companies of mine that we've backed in the last few years, are using computational AI modeling to develop new combination therapies, first in obesity. And they started the company. They built their first computational model, which predict a certain combination of drugs that would be not only more effective than the GLP-1 drugs on the market, Ozempic and Mounjaro, but also had a lower side effect profile. And they tested that prediction in mice and showed that the prediction was pretty much exactly right. And they did that all in 3 months. Now that is remarkably fast to go from starting a company to building a prediction to proving the prediction in vivo. I think that's a great example of how you can move very fast on a very short timeline.
And that's really interesting too, because in obesity, I think it's underreported how challenging the adverse event profile is for the current drugs. I've seen real world studies where roughly only a third of patients remain on the drug after a year due to the GI upset, etc. So it sounds like this company could be a pretty significant change in how obesity is being treated.
Absolutely. And in fact, they just published some work in the last week, which it helps to explain some of the challenges that people have on those drugs. And what they uncovered was something unexpected that I think nobody else had seen before. It's been observed that women tend to have larger side effects in some of these drugs than men, and they showed that this apparently is tied to some of the variation in hormone cycling in women. And so they have been able to uncover new biology using their platform and show very clearly why it is that women are impacted more by these side effects. And even better, they've figured out ways to have better drugs for women so that this isn't as much of an issue anymore.
That's really interesting too. And another connection to one of our other episodes with Marina Gerner. There's not a lot of studies done to understand why women react to drugs differently than men, but they do, and it's critically important, even in preclinical studies, to make sure that sex differences are being studied at the earliest of stages.
Completely agree.
Now, I want to pivot to advice for founders, talking about your founding journey, which we talked about, and your investing journey as well. So we can include all of those different angles for advice for our activator members and alumni in our audience. So you made the transition from PhD student, academic to founder. I'm curious your experience with that, how you decided to go take the leap from being a PhD student to a founder. We covered it a little bit earlier, but want a little bit more about the decision making of that. And what are the challenging themes, situations that you underwent on a personal and professional level when you make that kind of a pivot?
Sure. So I think one of the things that led me to start a company is opportunity for impact. So I'm very much of a results oriented and person who likes to see a tangible outcome of my work. And a lot of academic science is basic research, which adds to the world's sum total of knowledge, which is a worthy pursuit. But we've generated a lot of great knowledge and a lot of great research, and translating that into something that can actually impact people on a day-to-day basis really motivated me. And luckily I had two great co-founders, John and Jarrett, who the three of us all knew each other well and had worked together before and had complementary skills and a complementary vision for how to build a company around that. I think in that transition from academic science, where realistically all of us who have a scientific background are usually starting, into being a startup founder, is going from proving things to building things. In academia, success is a lot about what you know. In startups, it's about what you deliver. That mindset change is massive. You need to stop optimizing for perfect and start optimizing for impact. And you also, I think, need to really flip the way that you talk about your work. My co-founder Jarrett wrote this great article back when we started about what he had to unlearn about his PhD in order to become a startup founder. If you think about just the way that academics talk about their work, usually an academic research talk is like 45 minutes long, which is too long usually. And a startup pitch is short. It's ideally like 10 minutes, 15 minutes maybe. And in an academic research talk, you say very little about who you are and your background and your credentials, and you focus in all the details in an excruciating amount of technical precision. In a startup pitch, you talk a lot about who you are and your background and expertise. And you talk a lot about the big vision and the potential impact. And you talk usually very little about the details because it's easy to get lost in those. So being able to take your scientific training, which is an asset, and transform that into business that's a superpower. I think if you can, show that you've been able to work independently and in a research environment, but if you can make the leap, take all of those skills that you have and focus them towards a singular goal and move as fast as possible, that's the shift.
Yeah, that's super interesting. And one follow-up on that, which you mentioned, and which is super crucial. So basically, unlearning everything that you learn in academia, and especially showing off that you did who you are, which, as you said, is not usual in academia. So like you're surrounded by amazing people and you're just, kind of you keep your nose down and you just do amazing work and you let your work speak for you. So what advice would you give to our listeners who most of them are coming out from their PhDs and they might have amazing ideas and they might have amazing credentials and things that they've done, but they are not taught to talk about that and not taught
Mhm.
to not brag, but basically show what they did.
For sure. I think it's quite common for all of us when we're surrounded by people who are usually farther along in their career than we are, especially when we're PhD students or even postdocs, to feel a bit of imposter syndrome, to have the sense that you haven't accomplished that much. And the reality is that, when you're doing advanced research, you are at the very forefront of that area and really one of the world's experts in that. And that's not something that a lot of us naturally feel comfortable saying, that we're a world expert in something. That's not to say that you should be unrealistic or not, be humble about where your contributions overall. But I think it's just remember the context shift from being in an environment where everybody has an advanced degree and is working at the forefront of science to the general population. It's a much different setting. And I think that's just part of the adjustment we have to make. At the same time, though, it's really one of the hardest parts of the transition is remembering that it's not about the technology, it's about really solving a problem. YC's motto is build something that people want. And that's critical, is to take the research or the technology that you're excited about and make sure that you're focusing that on actually solving a problem and creating value.
I think one of the points that you hit on a bit around storytelling is very interesting because, in my, engineering curriculum in undergrad or in medical school, when you're looking at earlier stages of research, the goal when you're communicating it is saying like, oh, this is very interesting, like, but we don't want to promise anything. Like you try to be relatively conservative about what the findings mean. Often there's oh, and this is worthy of follow-up in a future study. At least from my understanding of the startup world, I mean, feel free to put in your perspective here too. You need to be talking all about the potential, not lying, obviously, but you need to say like, look, these are very interesting findings and it could have applications as a new therapeutic or as a new diagnostic in the case that of your company, Cofactor Genomics. So curious on how you think about the storytelling differences between presenting in the academic setting versus in the startup world.
So one of the biggest problems I had, and I think probably a lot of people have had, is remembering that you've spent years absorbing the very obscure jargon of your specialty that no one else knows. And it's really important to be able to strip all that away and speak like a human again. People talk about the mom test. Can you explain what you do to somebody, to your mom, to somebody who's not, trained in the same field that you are? And I think that's a huge part of being a good storyteller as a scientist. And that also lends to the idea of speaking about the potential of an idea. The more focused you are in pursuing a goal, even if the particular way in which you're going to get there isn't clear yet, that gives you focus in how you can speak about it too and what the potential is. I think, especially as an investor, I understand that there are challenges along the way, many of which are unforeseen. But my job is to look at what you're doing, how you're thinking about the problem, and really say to myself, if everything goes right, is this team going to be able, do they have a good shot at being able to achieve this goal? And does that goal produce something of tremendous value? The other piece of the puzzle is that as scientists, we're often focused on abstract reasoning and talking in concepts. And this is very hard to communicate to other people and to use abstract concepts in communication. And so I like to steal a line from one of my favorite comedians, John Hodgman, who said that specificity is the soul of narrative. And I think that you can illustrate an abstract point or a concept much better if you can give a concrete example and really give somebody something to hang on to. Ideally, it's a real example that illustrates the point, but even an analogy is better than asking somebody to come along for an abstract ride with you.
So when it comes to practicing that, that difference, right? In addition to having, I'm assuming, less time to pitch your startup, classically an elevator pitch, and using some of those elements that you talked about, like using specific examples rather than abstract concepts, how would someone who's, let's say, joining the activator program now, interested in conveying their idea to a broader audience, how did you figure out how to do that? Did you practice? Did you talk to friends outside your field? What was it that helped you the most when it came to refining your pitches?
Absolutely, that all of the above. So, you can hone it as much as you want in a vacuum, but that's you usually find out pretty quickly when you go talk to somebody else how effective you are. So definitely pitch to people who you know and who maybe know enough about what you're trying to do to be able to give you some direction about it, and then you can kind of move a little farther away. Whether it's somebody in your family or friends who are not in your field. Do they understand the idea and the potential? But obviously, when you start going to talk to investors, pay attention to what they ask about, what seems to resonate, what parts seem to be working in your pitch and which parts aren't. And I think everybody has to go through that process of refinement and iteration as you go through it. There's really no way to get it perfect by yourself. You have to go out there and test it, just like your startup ideas.
That makes a lot of sense. Now, you mentioned briefly when you're thinking about a startup from the investor's point of view, and you're saying, assuming that everything goes right, that this is an outcome of tremendous value. That's obviously subjective. That's why people like you work as investors. It's why not everyone can be an investor, right? There's a subjective judgment there, and having significant experience is a good way to do that. But curious on, how do you make that judgment yourself? Is there a framework you use? Is it about pattern recognition? What is it that allows you to judge, is this something of tremendous value? I'm sure everyone who comes to you says they have the best idea in the world. How do you sift that out? How do you figure out which ideas are the most compelling, at least for a Pioneer Fund?
So in health and biology, it tends to be a little bit easier in that when we're talking about literal cures for cancer, it's a little bit easier to see the value. However, there are nuances there about regulatory paths, about other technologies that are being applied in the same way. So part of it is trying to understand the landscape, but really a lot of it is trying to understand, is this solution or this approach unique and interesting? Does this team have really unique insight about the problem, and have they a clear path to try to get there? And it doesn't mean that you have to have everything figured out, but I do think that you need to really show that you have thought deeply about the problem, that the problem really has large potential. You've done some of the market calculations, let's say, that are reasonable in a bottom-up way, and that you can communicate those. It is, however, though, surprising to me. One of the things I've learned as an investor is that if I talk to founders and hear a great pitch, and it's really not about, I should say, the quality of their pitch, but rather the content of what they're saying is really compelling. And I find myself with my biggest objection is about the size of the market. Often that's a pretty weak objection. And that may seem counterintuitive to you as it did to me, because you have to remember that we're projecting out into the future and trying to understand what the world is going to be like then, and not so much what it is like today. Part of what the best founders can do is create new markets that didn't exist before, or that the rate at which people use something is changed by the solutions that they have available to them. So just because something has low utility now with a solution that sucks doesn't mean that there will be low utilization of that in the future when there's a great solution. So I think that kind of market component is not always the best way to judge value. It's really more about the scale and the scope of the vision. Do they really understand, what this company could become in 5 or 10 years if everything goes right? What do they want to achieve?
And that's interesting. So a lot of investors, I guess more mature investors, are going to look at what is the market size and what is the rate of growth. But as someone who's putting the first check in, I can see why you'd be interested in thinking about what new markets can we create with a novel technology that solves a substantial unmet need. So the unmet or the market size may be based on the potential number of people affected by a condition who aren't getting their needs met. And then a novel technology can effectively build a new market that's different than what currently exists.
Or they can expand into adjacent markets, right? So a good solution often can be applied to multiple related problems. And if you can also, the more on the, let's say, the digital health side, we have invested in a number of companies who have effectively been using AI to solve problems in a particular vertical or subspecialty at a remarkable rate. And we see sometimes other investors saying, well, that market's really small. It's not really venture investable. But we can often see that if a company can solve a problem or one problem in that market, then they can expand to other problems, solving other problems in the same market, or they can expand to solve similar problems in adjacent markets. But I think the point about the sort of the potential of the founders at the beginning and their velocity is a critical one, because ultimately, you have to understand what is the reach of the person, and know that there are going to be challenges that are encountered along the way, and look for people who seem to be ready for that.
Let's shift the gears a little bit. You mentioned AI a few times, and you mentioned a lot of companies that work with AI. So overall, there are also people who say like that AI and everything that goes within is the hype cycle there. AI is like on the bottom right now. So curious about your thoughts about it. And what do you think, what is the realistic value proposition of AI?
So more generally, I think that health and bio is one of the most underrated and underappreciated investment opportunities right now. And part of that is due to a couple of long-term trends. We have more and more computational people getting into biology, and that's been a long-term increasing trend, which is a really positive impact on the field. We also have a long-term positive trend of increasing data available. So we've all seen the famous graph about the exponential growth of sequencing data, and that is definitely a huge impact on our field. But it is now also clinical data and medical data, I think that is increasing at a similar rate. So those two long-term trends of more computational people in the health and biospace and more data available in that space is now being overlaid with the transformer model revolution. And AI is really a catalyst for accelerating those already positive long-term trends. So there really is going to be, I think, more progress in the next 5 to 10 years in biology than we've seen in the last several decades. And AI is going to be fueling part of that. How do you separate the truth from the hype, let's say? I think it's difficult to think of AI as a monolithic thing and the applications of AI approaches as a monolithic thing. So we have seen advanced machine learning approaches break boundaries that seemed intractable before. So AlphaFold winning the Nobel Prize a couple of years ago is correctly recognized as a significant breakthrough. But I think we're already seeing companies that are elaborating on that idea. And we tend to think of AI in terms of the general models or the foundation models that are, from, say, OpenAI or Anthropic. We are already seeing people build more specialized models to solve problems in health and biology. And I think that specialization trend is going to continue. And one of the advantages of specialization in this way is that you can build something proprietary. We think about the rate at which AI is advancing as really almost too fast for us to comprehend how quickly things are changing from month to month. And so sometimes you might see a company that builds something or has a product which seems like it's likely to be absorbed or subsumed by existing models as they get better. But if you can stake out a proprietary, build a proprietary model or build proprietary technology on existing models, then you have a moat. You have an ability to grow that ideally as AI in general gets better and the technology gets faster and cheaper, that your proprietary edge continues as well and even can grow. So those sorts of things I think are really critical to look for in a company that's using AI in any field, but particularly relevant in health and bio.
That makes a lot of sense. So having some sort of differentiated approach, either from the model side or from the data side, something proprietary and valuable is the key, it sounds like.
Yeah. And let's not forget that execution and rate of execution are still critical. So however fast the models are growing, you need to be able to move fast yourself. You still need to be solving a real problem for real people. Those fundamentals don't change. And just because you talk about AI as part of your product doesn't mean that that you've got a good solution.
For sure. And one thing that's been talked about on the macro level, this isn't really applying to bio and health. As you mentioned, there was a Nobel Prize for AlphaFold recently, but some folks are considering the current environment similar to the dot-com bubble in the late 90s, early 2000s, in terms of there being a lot of hype, a lot of investment dollars going into any company that throws AI/ML into their name, even though those two things are very different. And there's a lot of investment dollars, a lot of inflated valuations. Do you think that's accurate? Because with the internet, obviously there was Amazon and there was pets.com, right? That came about during that time. So there was real value to be, created during that time, but there was a huge shakeout. Do you think we're in a similar moment, or that we could be in the AI investment cycle right now?
I think there are sort of two related questions there. One is, are there companies building which aren't really doing much with AI that's unique and are unlikely to survive? And are there investment dollars going after those? Undoubtedly, that's true. And I think that's true of any new technological cycle where we see um, suboptimal decisions being made, even by smart people. But I think the related question is the potential for AI massive? And I think that's unquestionably true. The way in which it will unfold, we don't really know because it's moving too fast. Humans are terrible at exponential reasoning. This is part of why, when we invest in a company that is showing a high growth rate, but it may be the absolute values are small, that it's still a great bet because it can grow big pretty fast if it can continue to grow at that rate. It's clear that we're not really sure what's going to happen, but we're already seeing significant impact. And that's amazing. That this is, one of the most exciting times, if not the most exciting time, for new technology to be applied across a wide range of fields. And I think, as I mentioned before, health and bio is sort of the sleeper hit here. It is a multi-trillion-dollar opportunity. We have not just the ability to create tremendous financial value, but tremendous human potential value. We have seen over the last 20 years, some types of cancers go from a death sentence to a chronic illness. That is something that is not fully appreciated. A lot of that has been driven by computational approaches, and we are still in the early innings of what we're likely to see because humans are only really capable of absorbing a certain amount of detailed information at holding a context frame, as you will. But augmenting our ability with computers, which are excellent at doing that, and now having computers that can analyze that data for us, allows us to expand our human scope. And so I think it'll be inevitable that that translates into significant advances and huge companies in the health space. And we're already seeing some of those being born today, and those are the ones that we're trying to invest in.
That's fantastic. And, can really sense your optimism. When we previously talked to the head of this episode, he said, now's a good time to be a founder. It's an exciting time. You've been, talking about this in terms of the technological solutions that are being developed, the innovations that are happening are really rapid right now. And like you said, early innings in terms of how we apply computational approaches to biology. So it is very exciting, and I fully agree with that. The one thing I'll push you on is the capital markets and how that intersects with founders right now. So there have been a bunch of layoffs happening. This is more on the therapeutic side, even from big pharmas, small biotechs, including several shutting down. And capital markets, at least for early stage investing, have been challenging for founders. I have personal friends, Nucleate alumni, who've had to shut down their company. So I'm curious. So how does someone who's excited about a technology see those headwinds or those challenges right now, but still have very exciting technology? How do you encourage them to become a founder still? How do you suggest one would navigate this kind of environment?
Sure. So the first thing I'll say is that it is quite common to see amazing companies being born in times of hardship. Part of that may be because the relative cost seems lower. I guess the relative risk seems low, than pursuing a more traditional route. But I think another way to look at where we're at today is that there's never been a better time to start a company than now, because the cost of starting a company or creating has never been lower. It's never been easier to get the resources that you need. And I don't mean just financial resources. I do think there are lower financial requirements. You can build more on less money today than you ever could. But the universe of knowledge available to you, the toolkit has never been better. You have open source AI models, cloud labs, programmable biology, and especially at the earliest stages. And more importantly, the need has never been greater. We're still facing, massive challenges in how long we live, how well we live, how we experience healthcare. We have still lots of diseases we barely understand. So to me, we're at a technological and maybe a social inflection point. If you're mission driven, if you're scientifically fluent, if you're execution focused, never been a better time to start.
That's fantastic. Now, within this current environment, with NIH funding getting limited in universities, and a lot of our audiences are aspiring to spin out of a university, how do you suggest that someone in that situation navigates the current funding environment with maybe not eliminated, but reduced grants available and navigating early stage fundraising?
So I would characterize the current NIH situation as one of uncertainty. I definitely can relate to all of that. It's not a great time to try to pursue something which requires federal funding when we just don't know what the picture is there. I tend to be optimistic about it, actually. I think that NIH funding will stabilize, and even if it doesn't, that there will be other mechanisms that fill the gap. But even if we just sort of take the current situation, it's never been less expensive to start a company than it is today. And that includes in health and bio. In 2025, starting a health company is like starting a software company in 2005. The tools are there, the world needs what you're building. And if you can go, you can just go do it. You don't need a fancy lab space. Cofactor rented regular, like a back room of a building. We used IKEA tables for lab benches, I think up until our Series A. So, you don't need to have high dollar per square foot, premium lab space like you're used to, especially in today's world where a lot of biology is happening on a microliter scale. And a lot of biology today is computational, and it has never been cheaper to get access to huge amounts of computational power.
That's fantastic. And very interesting to think about that the costs for a company today in biology is similar to tech company in 2005. Seems like a step change in terms of like you said, the computational side, the analytics side, and the ability to do smaller scale experiments and run virtual companies too. Most of the folks I've talked to starting companies have a virtual model, so relatively low overhead in terms of space requirements. So Dave, I'm curious, as an investor, and again, keeping to the theme on advice for founders, you've heard lots of pitches, probably thousands, maybe millions. I don't know. I'm sure thousands.
Hopefully not.
Thousands, tens of thousands. What's the most memorable pitch you've received? What made it so memorable, for good or bad?
One of my favorite pitches we ever got was from a company called SPRX. So SPRX uses AI to help prepare corporate R&D tax credits. And Dominic, who pitched it, is an amazing founder. He came from a traditional tax consultancy background. Normally, when you're trying to apply for or use R&D tax credits, it's a long, tedious, slow, expensive process. It takes months and usually multi six figures to pay somebody to do. And Dominic realized he saw AI happening. He realized its potential to dramatically change this. He went and partnered with OpenAI for early access before OpenAI was even really widely known. And now SPRX is delivering complex tax paperwork for tons of companies in weeks instead of months at a fraction of the cost. Very clear to me from the beginning that this is the perfect founder who understood the problem deeply, having been working in this space for years, and a very clear application of new technology to serve a huge market.
So tax, not a very sexy area.
Not sexy at all. I love the unsexy ones like this. So, you can build an amazing company in an area that sounds a little boring.
So what was it then about this pitch in this unsexy area of tax Yes, using AI, but curious, like, what was it about the pitch that really resonated? You mentioned the market story, but just curious, like, was it the delivery? Was it that he was able to simplify the concept? What was it that made you convinced that among all the startups you were looking at, that this one was one worth pursuing?
Yeah. I think it's worth noting that we at Pioneer try really hard not to index too much on the quality of the pitch. In fact, sometimes even if like the pitch is too good, it can even be a little bit of a negative signal because we're aware of the fact of how good the pitch is and that it's very persuasive. So we try really, really hard to just listen to what the founder is saying and not how they're saying it. In Dominic's case, he was also good at pitching, but what stood out was the clear expertise he had, the clarity of his vision for the product, and the fact that he already had customers and had shown that this was working.
So it's interesting to hear you say that, mainly because there have been very successful entrepreneurs who say Theranos, say, Adam Newman at WeWork for different reasons. Very charismatic founders. Do you have a way of convincing VCs? And there's kind of a lemming-like effect. So you mentioned you try to ignore that to some degree in terms of the how compelling or how charismatic the founder is. How do you sift through that? How do you make sure you're checking yourself when you're like, okay, this is a really great pitch, this is really exciting. Like, how do you pressure test what you're hearing?
One of the things that I think Pioneer does really well is discussing collaboratively each pitch that we hear. And we independently arrive at our initial conclusions about it, but then discuss. And we try to always let the most enthusiastic perspective lead the way because we don't, even though we discuss and we're collaborative, we don't insist on consensus. And in fact, sometimes the companies that we're most excited about are the ones that are the most polarizing. So it's really important to hear different perspectives, but it's also important to get some distance from it. And so when there's a challenging decision to be made, bringing in other people who maybe weren't in the magnetic field of the founder to look at it maybe from a step removed can be helpful. Sometimes just sleeping on it, to be frank. You have that enthusiasm, that electric feel of an amazing pitch, but the next day, maybe you had a little bit more time to think about it, some of the magic's worn off and you can see it with clearer eyes.
Got it. That makes sense. So making sure you're acknowledging that there can be a bias there for charismatic, compelling founders who tell their story well.
Absolutely. And as good as the Pioneer team is at making decisions, I think we are the first to admit that sometimes we get it wrong. And, and I don't mean just in the sense of like being overly impressed by charismatic founder. Actually, more commonly, I think, is the opportunity or the possibility of maybe not appreciating a company the first time around. And we sometimes will go back to a company after having passed and say with much humility, we got this wrong, and if you'll have us, we'd love to invest. I think it's really important to be introspective as an investor about how you make decisions and try to be aware of maybe when you've made the wrong one.
So when it comes to decision making, you hinted on this that sometimes you'll move forward with something even if there is a split decision or it's not consensus. How do you all navigate those situations where it sounds like, one or more partners is excited and there's a few on the other side? How do you come to a conclusion and decide to move forward in those situations or decide not to?
Sure. So it's not easy. I think Pioneer very much, we take the power law view of venture. The reality is that a few companies will drive most of the returns for a fund, and this is true for all of us in venture. So we believe that it's far worse to miss a potential outlier than it is to possibly invest in a company that doesn't succeed. Because the reality is that there's going to be this distribution of outcomes, and the very strong outliers are going to be the ones that matter the most to any fund. So we have built a lot of tooling to use behind the scenes to allow us to look at a very large number of companies and to do this efficiently with a very large number of people with deep expertise. And at the same time, to try to be able to kind of have a view of the whole universe of companies that we know about at once, so that we can, even though this is really, really hard, try to be able to compare across different companies to help us make some of these really challenging decisions. And, you know, all the things that I mentioned before, sort of listening to different points of view, being really introspective about our own process, trying to apply different frameworks that we know can make a difference in the potential outcome for our company. All of these things you put together, and we try to take this data-driven approach of sort of looking at a lot of things in a uniform way, but also with some of the art to it of what we know makes a successful company.
That's great. And interesting that you're able to find ways to resolve those kinds of conflicts and figure out best path forward. And it's interesting too, the strategy of working with a lot of different startups. And it sounds like there's a lot of different ways too that you work with startups. So curious to hear a little bit more about that in terms of what is your engagement with each company that you fund?
Pioneer is a fund of startup founders. And so when we invest, we've had experiences with lots of different types of investors as founders ourselves. And when we invest in a company, first and foremost, we trust the founders to run their company. And that means that we are there when you need us and not when you don't. So for every company, the engagement can be different. And it often changes over time. So during a period when we have just invested, often founders are trying to fundraise and close their round. And so we worked with them both strategically to think about how to structure that round. We work with them to introduce them to other investors in our network that we know are likely to be interested in the company, and whatever else can come up sort of in the heat of it. Most important for most founders is to, especially when you're early stages, to fundraise quickly and to get it done and go back to building your company. And we try to help enable that. Over the longer term of the relationship, we often provide advice that is technical in nature about some of the things that are relative to running a health and bio company. But we also have, a huge network of founders who have expertise outside of health and bio. And the reality is that there are fundamental aspects of running a company that are common across all types of companies, no matter whether they're highly technical in nature or not. And so we have a huge amount of people who have faced many of the same challenges that every startup founder faces, and we can help with that. And more generally, just as founders ourselves, we can be helpful with all of the nuances of that and what it's like just to be in the thick of it. It is an amazing experience to be a founder, but it's also a very challenging one. And some days it really sucks. And so having people there when you need them who can relate to that and maybe give you a different perspective on the challenge you're facing at the moment, hopefully is helpful to a lot of the founders we work with.
And it sounds very much like a founder's approach to supporting founders, there when you need them in any way or shape or form, and knowing when to get out of the way to allow the founders to do their work. When it comes to the entrepreneurs that you work with, what's some advice that folks have the most difficulty incorporating? And in those situations, how would you suggest they go about it based on what you've seen?
The most difficult advice. I think it depends on the person. Different people have different strengths and weaknesses. I think the thing I see most commonly in the health and biospace is that they feel like they 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 need to move faster than they are moving. It sometimes can take some adjustment to realize that you can actually move much faster. Another related challenge is focus. We have the great advantage and opportunity when we're creating new technology, particularly something in health and bio, that it can have very broad applications. But this does not make a great business, particularly as a small business. You really have to be laser focused on solving a particular problem. And you have limited resources, you need to be able to harness those all in the same direction, even when you see the potential for your technology to be applied in more than one area. So part of the challenge is figuring out what is the best place to go first. And a lot of that is from talking to your audience, talking to your customers, whatever type of customer they may be, to understand, is this really a big problem for this set of people that you can solve for them right now? And if you can do that, and if you can do it faster than you maybe realize, then those have a compounding positive effect where you can move much faster to solve the problem for the right audience much more quickly than possible. And you can grow very fast doing that.
And I'm sure founders have plenty of distraction, to your point on focus. Never mind electronics, just, if you're developing a platform, it could be used for A, B, C, all through Z, making sure, like you said, you choose the right one to start with and then stick with it, at least until you get to a go, no go decision. Like, does this make sense to continue? Are we getting the results we need for us to continue down this path?
Absolutely.
So, final question. Any last thoughts for our audience, for the founders who are listening, who are in our activator program at Nucleate? Any final advice, personal, professional, that you recommend?
Sure. I think the advice is simple. Just go do it. You know you want to. That's why you're in Nucleate. That's why you're listening to this podcast. It is not going to always be easy, but you're going to learn more than you ever thought possible. And you have the potential to achieve something that is going to make a huge impact, both for you personally and hopefully for the world. So now's the time. Don't wait.
And on that note, just go do it. Thank you so much for joining us on the podcast today, Dave.
Thank you both very much. Lots of fun.
Thanks for listening to the Nucleate Podcast. Be sure to subscribe if you'd like to keep up with future episodes. See you next time.